Well, thank you to all of you. Thank you for everyone who stayed until the very end. We have this fantastic segue that has been done with François Langlais about the average age of the people present here in the audience. Well, for this specific roundtable, I believe that we have the average age that went a little bit down. So I think that right now we are below 30-year-old. Well, I believe that it's a little bit like during the wedding. We have all the different tables, and among them there is a table for kids. But I think that it's just as interesting because here we can see and talk very freely and very simply. So I actually had been thinking about this intro that will be absolutely eloquent and brilliant, but finally it has been summarized in a couple of words what we appreciate to do, because we were talking about the increasing of the level of the culture, if you remember well, because the young people have to be informed about the world that they're coming in, so that to understand the system and know how to work with it. So this is pretty much the program that I would like to suggest to you for the end of this day. So simply presented, it will be a debrief of many different round tables, a lot of different things that have been said today, precious things. So the very first question, what do you really remember in terms of tangible, efficient, and possibly financeable and supportable solutions? Well, even though this is not our work, our immediate work, and I would like to start with you, Ilona, because you are a student, a student in nursing. Well, probably my vision is a little bit too idealistic with respect to all of this, but the tangible and financeable solutions is quite a lot of criteria, I would say. I didn't really find something that would be unique in terms of solution that we can apply, I would say, tomorrow in the territories, on the field, with the patients, in different services. But something that impressed me a lot during this day was this moment when the person from the United States did his presentation, and he talked about Amazon, because apparently the United States are 10 years ahead of us, and everything that happens in the United States today will happen in 10 years here in Europe. So I don't know whether someone is convinced by this idea or not, but for me this is scary, and this is something I tell myself that will happen for us 10 years later. So I think that this is a new point of view, probably, that can give us new elements with respect to the topics that we are tackling right now. Well, knowing that this is something that already exists in France, so it's not really 10 years of head start that they have. And Jessica is the director of a hospital, so the future director, hospital director, and this is what we wish for her. So the same question for you. Did you find a suggestion, a proposal or something? Because we have heard some very concrete, very tangible solutions that have been proposed. So what is the one that you remember? Well, globally, the one that I have really written down is that we all agree on the point that we have to work all together, not in silos, and we have to diversify our models as much as possible. So what I actually remember is that globally the hospitals that are waiting for us as directors will be the hospitals that are not well. So we will have very quickly, we will have to suggest the solutions that will be ingenious. And right now, today, I don't have all of these solutions, but this is not really a big problem, because are you expecting to have all of this? So probably tomorrow you will have some solutions. Well, we agreed on the fact that we were talking about the ideas and not about the implementation, because for the implementation of all of these ideas, I would be probably a little bit more brief and reserved, because we are, what is important is for us to start from the main point and then go into the main goal. So that's important. And in terms of the ideas, I would like to say that in the public hospitals, there are patients that are coming, and very often it's a little bit complicated for these people to have a lot of money and to finance their own health care. And beyond that, globally, I think in terms of the cooperation, public and private sector, that's something that has to be explored. So that's an important point that has to be explored in terms of the financement of the medical bill, I would say, for the cardiologist, for example. And, well, the same question for you, Guillaume, because you are a cardiologist and you are at the university hospital right now. So what is something that marked you the most from what you have heard today? Well, I would say it's the strength, but also the weakness of SHAM is that we actually have a lot of beautiful ideas here, but unfortunately it's very difficult to implement them at the societal level later on. Because for us, it's very difficult to basically come out of the ideas, meaning come out of the ideas, put these ideas in practice, I would say. It's very difficult to make all the citizens accept these ideas and start implementing them. So we are coming out of this 2 absolutely incredible, fascinating days of debates, but then we have to face the practical side of all of this, and we can say that, well, I have seen the Minister Rousseau, who said that we could say absolutely everything. So there are some ideas that I found very interesting. Well, the relevance of the healthcare of the treatment, because right now we are thinking about acts, and they are being rethought from the point of view of acts, meaning that a healthcare professional will be thinking about prescribing better but less, given that the service will be financed per act, meaning that I will have to employ more nurses and more additional staff if I will have more acts. So another issue that I found very interesting is the legal side, not the legal side, but the relevance of all of this, because if we are prescribing more, we're probably being covered against the error in terms of diagnosis. So just taking this example given by the academia, we can basically give the possibility of decision to the patient. So it's kind of difficult to prescribe, and prescribing is a useless act that costs a lot of money. So the relevance of the treatment must be reviewed from this point of view, from the point of view of the relevance in terms of the financement and in terms of the relevance from the point of view of the healthcare professional. What I found particularly impressive is this talk about the prevention. We have been talking a lot about prevention from different point of view, and I think that this is a topic that everyone agrees upon, because no one can be against the prevention. So that's something that helps us to save money, but at the same time, I understand that the Minister of Health, that is here, one of them, because we have many of them, so up to you to find who it was talking about the VIH vaccine, and said that it can approximately cost 240 million, and gynecological cancers will be at approximately the same price, 230 to 240 million. So you will have a direct effect, but the prevention is still a bet. So you have this preventive policy, but then you have to evaluate the impact. And here we can go in the wrong direction. And here is a very interesting connection with all these round tables. Can we probably, and I don't say cancel the prevention model and talk about the preventive model that I heard talking about at some of the round tables, but probably go to the next step and play differently with the tools that already allow us to do it, meaning the artificial intelligence, the creation of digital twins, or probably some complex things that are still feasible today. And finally, coming from this bet that is the prevention to something that is sure, which is a preventive model. Well, that's actually very interesting, because before that we have actually heard speaking about the prevention not being something that relates to the doctors directly, but to the prediction much more, because everyone is talking about this, but no one is actually doing it. But it's probably very interesting to just entrust it to someone else, to some other specialists. So, Ilona, when we're talking about this prevention, when we are looking at the current situation and so on, well, we understand that this is something that has been improved from the economical point of view at the long run. So what did you hear in terms of the prevention that actually impressed you and that appears to you as the most relevant? Well, in terms of the prevention, well, the prevention has been tackled quite a lot throughout all the different round tables, and there's this important connection that has been made, which is very interesting one with municipalities. We have just mentioned it indirectly, I would say, because we also have this important challenge. How can we distribute the weight on all the different stakeholders? And I believe that the municipalities can play a very interesting role here at the level of the prevention, just as the students can participate in the development of the campus, but also the development of the territory. So I think that everyone can play a certain role, but in a different way. And I think that this specific point wasn't mentioned directly. We have tackled it, but indirectly. We have talked about the education or going like a little bit outside, beyond the healthcare world. We have talked about the elected representatives at the different levels. So how at the municipality level we can make decisions today that will improve the healthcare situation and probably create this local health contract and so on. But we can actually look at different levels here. The roles of nurses, of course, in terms of prevention, that's crucial and that's essential. So I will not deny that. But how can we coordinate better all the stakeholders and make sure that every single professional in the healthcare will be bringing something forward for the patients, so that to build this culture of prevention? But I'm not really sure that we will be able to do it massively and collectively, at least from what I have been able to see with the patients when we're trying to do the actions that have a group of people too important. We are basically losing this point that will allow us to make the vision of one person evolve. Whereas when we're working with a person directly, following this person and explaining them the pathologies and the situation, we have to implement very concrete actions that they will be able to implement in their everyday life. Well, of course, it takes a lot of time, but I don't see another solution here than to tackle it step by step and to make sure that every single stakeholder will practically bring something in. Well, of course, you are not the only one here. And from the point of view of this reaction, well, we are explaining it to each other. So this will not be just the healthcare professionals who will be in charge of the health and the healthcare. All of us have to participate in this specific landscape and actions. Well, from this point of view, I believe that the most important stakeholders must be the patients. And I think that most of the roundtables have mentioned it indirectly, because we talked about the issues for the remote surveillance. And so it's the question of responsibility. How can we increase the responsibility of the patients so that they will be at home, they will understand what they are doing and why do they have to measure some indicators and so on, and why they are being invited to go back to either the hospital or the healthcare institution or to the doctor that is the closest for them. So I think that today the debate is not that much about the part of this cake that we will take and leave to the nurses, to the doctors, and so on, but about this part of responsibility that we will give to the patient, and about whether we give them or not a place within the healthcare system, not just the hospitals, so that to like really take this ownership of all these changes, but also take the ownership of the diseases that will happen for them, like because we have already mentioned the aging of the population and so on. So the patients have to understand what is happening to them, because sometimes this is not something that will just disappear within a couple of days, but they will have to live with it. So I think that that's an important element that must be highlighted here. So the patient, how exactly do we make them participate, and who will be this patient? Guillaume, so up to you. So you have heard this word patient being said here. So what do you think about all of this? Well, I think that for the doctors, we are actually feeling this situation quite a lot. And there is an interesting element here. It is true that we are in this quite complex period of time, and we actually have this social dialogue that is here. But at the same time, this period is also a privileged one for us, because we are all united here. We have the means to act collectively, and through this collective action, we would be able normally make sure that the healthcare would become a regalian topic, and the presidential elections that will be coming in 2027 call us to start working, whether we are doctors, nurses, or students, or whoever in the healthcare sector. We have this collective responsibility for all of us to unite and to create something all together, to create the system of tomorrow, because we understand that we have the prescriptions that has not evolved starting from 1958 or something. So probably we should think about the new models that can be suggested. And here I would like to call on the ministers. Please help us in here. So this is a very tangible proposal for the political actions in terms of healthcare. Well, thank you very much for this exercise of improvised reactions, because we are talking about this generation that is a lazy one, but I don't think that you are a lazy generation, because you are very much ready for all the debates and you are thinking about tomorrow. You will be here and helping us. Thank you very much.